Hello, ladies and gentlemen. We're talking about choking, and this video covers recognizing emergencies and how to help adult children and infants.
A person who is choking may look panicked, confused, or surprised, or hold the neck with one or both hands. You may hear coughing or high-pitched squeaking noises, or nothing at all. If you are with a person who starts to choke, first, ask the person if he or she is choking, or check to see if an infant is crying. Then, obtain consent to help. If the person can speak or cry or is coughing forcefully, encourage the person to keep coughing. A person who is getting enough air to speak, cry, or cough forcefully is getting enough air to breathe. But be prepared to act if the person's condition changes. If the person is making high-pitched noises or is unable to speak, cry, or cough forcefully, the airway is blocked. Have someone call 911 or the designated emergency number immediately while you begin to give first aid for choking. The person will soon become unresponsive unless the airway is cleared. After confirming that the person is choking and obtaining consent, give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach, right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or, if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm, flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts. After confirming that the infant is choking and obtaining consent, give a combination of 5 back blows and 5 chest thrusts. First, place your forearm along the infant's back, cradling the back of her head with your hand. Place your other forearm along the infant's front, supporting her jaw with your thumb and fingers. Do not cover the infant's mouth. Turn the infant over and lower her onto your thigh, so she is face down with her head lower than her chest. Give 5 back blows. Firmly strike the infant between the shoulder blades with the heel of your hand. Then, reposition the infant. Place one hand along the infant's back, cradling the back of the infant's head with your hand. Next, turn her over so she is face up with her head lower than her chest. Give 5 chest thrusts. Place 2 fingers in the center of the infant's chest, just below the nipple line. Press down about 1.5 inches, then let the chest return to its normal position. Continue giving sets of 5 back blows and 5 chest thrusts until the object is forced out and the infant can cough forcefully, cry, or breathe, or until she becomes unresponsive.